Hello and welcome. Today we're diving into a rare and fascinating condition called Plummer-Vinson syndrome, also known as Paterson-Kelly syndrome. This syndrome primarily affects the esophagus and is characterized by a triad of iron deficiency anemia, difficulty swallowing, and the presence of esophageal webs. The exact cause of Plummer-Vinson syndrome remains elusive, but it's generally believed to be multifactorial. Iron deficiency is a major contributing factor. Other suggested causes include genetic predisposition, malnutrition beyond just iron deficiency, and autoimmune disorders. Environmental factors might also play a role, but conclusive evidence is still lacking. It's important to remember that understanding the why is an ongoing area of research. Let's break down what happens in the body. The chronic iron deficiency in Plummer-Vinson syndrome leads to decrease in red blood cell production, resulting in anemia. This anemia weakens the tissues lining the esophagus. Subsequently, thin membranes, called esophageal webs, form in the upper esophagus. These webs narrow the esophageal passage, making swallowing difficult, especially solid foods. The syndrome also involves atrophic changes in the oral and pharyngeal mucosa, further contributing to swallowing difficulties. Plummer-Vinson syndrome is considered a rare condition. It's more commonly seen in women than men and typically affects individuals between the ages of 30 and 50. Historically, it was more prevalent in northern European countries and Scandinavia, but its incidence has decreased significantly in recent years, likely due to improved nutrition and iron supplementation. The signs and symptoms of Plummer-Vinson syndrome can be quite varied. The most common symptom is dysphagia, or difficulty swallowing. This is usually intermittent and worsens over time. Other symptoms include fatigue and weakness due to anemia, a sore tongue glossitis, angular cheilitis, cracks at the corners of the mouth, brittle nails, a koilonychia or spoon-shaped nails, pallor, a pale skin, and sometimes an enlarged spleen. Some individuals may also experience pica, a craving for non-food substances like ice or dirt. Diagnosing Plummer-Vinson syndrome typically involves a combination of physical examination, blood tests, and diagnostic procedures. Blood tests will reveal iron deficiency anemia, characterized by low hemoglobin, low serum iron, and low ferritin levels. An upper endoscopy, where a thin, flexible tube with a camera is inserted into the esophagus, allows visualization of the esophageal webs. Barium swallow studies can also help identify the webs and assess the degree of esophageal narrowing. Biopsies taken during endoscopy can rule out other conditions. While there aren't distinct types of Plummer-Vinson syndrome, the severity of the condition can vary. The number and size of esophageal webs can differ, and the degree of anemia and associated symptoms can also range from mild to severe. The condition is generally classified based on the presence of the classic triad of iron deficiency anemia, dysphagia, and esophageal webs. Treatment for Plummer-Vinson syndrome focuses on addressing the underlying iron deficiency and managing the esophageal webs. Iron supplementation, usually in the form of oral iron tablets, is crucial to replenish iron stores and correct the anemia. In severe cases, intravenous iron infusions may be necessary. To treat the esophageal webs, endoscopic dilation is often performed. This involves gently stretching the webs to widen the esophageal passage and improve swallowing. Regular monitoring and follow-up are essential to prevent recurrence of webs and ensure adequate iron levels. Currently, there are no definitive preventative measures for Plummer-Vinson syndrome due to the unknown exact etiology. However, maintaining a balanced diet rich in iron-containing foods can help prevent iron deficiency anemia, which is a significant risk factor. Early detection and treatment of iron deficiency anemia are also important, especially in at-risk populations. Awareness of the syndrome and its symptoms is crucial for prompt diagnosis and management. The prognosis for Plummer-Vinson syndrome is generally good with appropriate treatment. Iron supplementation effectively corrects the anemia, and endoscopic dilation resolves the dysphagia in most cases. However, it's crucial to note that Plummer-Vinson syndrome has been associated with an increased risk of squamous cell carcinoma of the esophagus and pharynx. Therefore, regular endoscopic surveillance is recommended. While research on Plummer-Vinson syndrome itself is limited due to its rarity, ongoing studies focus on the role of iron deficiency in esophageal health and the mechanisms underlying esophageal web formation.